Hi, Christy. Thank you so much for joining me this morning. I am looking forward to this conversation like no other.
Oh, thank you for having me. Very excited for it.
The San Marcos Unified School District put out a program called Let's Face It Together. Oh, I don't know, what, like a year ago, 2 years ago? What
It's
was
actually
that?
3 years ago.
Wow. And I read about it and was just so inspired and thought, people need to know about this. They need to know about it. What I would like to do, though, before we get into what the program is I want to understand the background and why, what was the inspiration to support it? What were some of the trends that you were seeing that said, hey, we need to take a more significant stance in all of this?
Yeah, no, for sure. I think, to start, the inception of this program really happened in the midst of the pandemic. And I think, within the county, within the state, nationwide, worldwide, we saw headlines everywhere telling us that, teens' brains were aging faster due to the pandemic and that there was an increase in children going to the emergency room with suicide ideations. And we saw that in San Marcos as well. And I think what the most alarming piece of that was is we were seeing it at younger and younger ages. And
Mm,
so, well, students having suicidal ideations prior to the pandemic was something that happened. We were seeing those numbers increase exponentially. And then to add to that, because the whole world was in crisis, the infrastructure that was set up to support mental health was at capacity. And so when students were needing support, when children were needing support, they were being placed on waiting lists that were 30, 60, 90 days long and not getting the support they needed. And when a child was placed on a hold for wanting to harm themselves, they were being released from the hospital without any support because
oh,
practitioners couldn't get them in fast enough. They had too many other kiddos to see. So we saw this as a huge problem, specifically within our district. We can only control what we can control. And
right.
so as a district, we said, the county resources are tapped. What do we have currently within our own district and our own capacity that we can do to help our kids? And so that's kind of where this started. And through those conversations and just talking with other partners, we were able to link up with the city of San Marcos, who happened to have ARPA funding that was COVID-19 funding. They
Okay.
saw the need and they said, hey, this has hit all of us, as well. Everybody had a story. Everybody knew somebody who either themselves or their child had gone through this. And so I think the timing was right, and they were able to give us a $2 million grant to really get this going. Um,
Wow.
and that really helped propel all of this forward. So that was kind of how it started. And it was
Hmm.
just having those conversations with different educational partners. And when lightning strikes, it strikes. And it happened to be the perfect timing with the city of San Marcos so that they could come on board with us and supply the grant that helped us really move this forward.
Wow, that is a great partnership between the city and the district. Wow.
Yeah,
Wow.
it was amazing.
That I mean, you hear $2 million, and in school budget terms, that's a lot of money. A
Absolutely.
lot of money. So I, I, I would be interested to see how other districts are able to do things that maybe don't have that same financial support that you guys had, but that was a gift. Tell
Absolutely.
me a little bit about the program. What is it, and maybe even what the district supplies outside of the program for support with mental health. I don't think a lot of parents know exactly what they can get from their schools and school districts in their area.
Yeah, absolutely. So I think, across all districts, there's different types of supports. Here in San Marcos, we're super lucky. We have counselors and social workers at school sites. And then we also have school psychologists, all of whom are mental health practitioners. And depending on the level of, so if it's elementary, middle, or high, depends on, which practitioners are at which level. So that was something that was already existing.
Okay.
San Marcos, prior to the pandemic, had definitely prioritized whole child education and learning. And then that was just, obviously further underscored with the impact of the pandemic. And so those were things that were pre existing. But with that, counselors have certain types of trainings. Social workers have certain types of training. School psychologists have certain types of training. So really making sure that we were streamlining what support looked like across the district, that was also a goal of ours, even prior to Let's Face It Together. Let's Face It Together really gave us the opportunity to, as a district, come together and say, you're not alone, and to really message that out. So that funding that we got, we knew it was one-time funds. We only had it for the 2 years. And
Mm-hmm.
so we really wanted to be intentional about what we set up so that should funding completely go away, the actual program remained. So
Mm-hmm.
investing in the current practitioners we had, the counselors, the social workers, the school psychologists, our nurses, was equally as important because they were going to be the folks that were going to help continue the work long after the funding was gone. So with Let's Face It Together, the campaign itself was a huge piece of it. So bringing in the city of San Marcos, they brought in their marketing and PR firm for us, JPW Communications, which is something that most districts are never going to get to have access to. And so
Wow.
that's why like this amazing logo was created by them. And if you come out to our school sites, there is messaging all over our school sites, from posters to wall clings. And it's all very positive, uplifting messages, just basically telling kiddos, you're not alone and
Yeah.
we can face it together. One of the things that I love is in one of our brainstorming meetings, we were talking about where do kids need to see this? And at the time, most kids are, as they're walking through hallways, especially at the high school, we all know they're on their phones, so they're looking down. So
Yeah.
the idea was we have them on the floors as well.
Oh,
So
that's brilliant.
and it's super great when you go to Mission Hills or San Marcos High School or Twin Oaks High School, and they're on in the walkways and seeing those pieces, because it's what the kids need. We wanted to make sure that it was very student focused.
Sure.
So that at like the very basic broad level was this campaign, so that
Mm-hmm.
everybody knew there were trusted adults in every space, and it didn't have to be a counselor. It didn't have to be the psychologist, but those were our mental health professionals. But it could be the cafeteria worker, it
Mm-hmm.
could be the custodian, it could be your teacher, it could be any of the number of folks we have on our campuses. We care about you. And so,
Yeah.
and we're here for you. So that was the big piece of like the messaging. The next level of support, we call it like our tier 2 level of support through Let's Face It, and this is where funding really helped us, is partnerships with some external agencies. So the crisis text line, which is a national text line, we were actually able to reach out and say, we know this is a resource for everyone, but could we have a partnership with you all where if students were to message SMUSD, San Marcos Unified School District, instead of just hello, we
Mm-hmm.
can actually get some data back about how many kids are actually utilizing this resource. So we paid a
Oh,
small fee for that. And it's only a couple $100 a year, which is wonderful because that's something that's sustainable.
right.
And we're able to get information from them. We don't know exactly what the messages are because it's confidential,
Right.
but we're able to see, is this resource being utilized? Are kids using this? And it provides 24/7 access to support so they don't have to wait to come back to school the next day to get help.
So let's take a step back real quick. I want to make sure that I understand and the listeners understand. There is a resource out there, a text resource
Yes,
that anybody can use.
absolutely.
And then you've got your subset, which is for San Marcos, which is amazing to be able to get that data back. But
Yeah.
what happens from the child's perspective when they text into that? What are they texting? Um, what are reasons that they're texting? What can they expect to get back? All of those kind of.
And before I forget, the resource is 741-741. That's a national text crisis text line. It can be used by anyone. And so it can be something as simple as I'm having a bad day and I need somebody to talk to. It can be I want to hurt myself and I'm reaching out. What we found actually just through some of the different research we did with kids when we were talking to them about, how the program was going, students are using the 741-741 to find out how to help their friends. So when they have a friend who they feel is struggling with depression or anxiety, they're texting 741-741 and saying, my friend told me these things. What should I do? How can I help them? And
That's
so something
amazing.
we didn't even think could happen. And it was just this wonderful result of this and the amazing, it just goes to show you how kids are so innovative and
Right.
for something, completely different, but they're utilizing that resource to be able to help their friends.
That's
Um,
great.
and so that I think when they do these messages, they get a live person that is communicating with them. And if at any point it seems that there's an imminent risk or imminent threat, the person on the other side of the crisis text line contacts local law enforcement, and they're able to
Okay.
drill down to where the location is of the phone that's texting and things like that. So, um, in the event that it is very critical, emergency resources are sent out. However, most of the time it is more students just need somebody to talk to.
And it's open for any type of discussion of or around. That's great. That's great. And is it only text, or can they engage vocally with somebody as well?
This one is just text. There's several
Okay.
different crisis lines
Yep.
out there. This is the one we partnered with simply because for our students, they let us know that text was their favorite
Any
way of communicating.
Anybody who's raised a teenager in the last decade knows that texting is like the key to getting their attention. So that's fantastic. That's fantastic. So okay. And then just to clarify,
Yeah,
everything that's sent through though is confidential.
100% confidential. And
So that gives
that was something we saw too when we first started looking at the data. We saw that the crisis text line wasn't being utilized that often, and so
yeah.
of course, us as adults were like, "Oh, we must not have been, getting the word out there enough. We should do more posters. We should do more messaging." But then we pulled in some students to talk to them and
Yeah.
asked, and they said, "Well, we don't believe that you're not going to know what we say." And we went,
Mm,
"Okay, so we need to really hone in on this is 100% confidential." And I think for parents, it's important and guardians to know that yes, it's confidential to a point, but
right.
when a student is critically in need,
Right.
100% services are sent out. So it is not just, it's confidential 100% of the time. It is confidential when kids need support, but the moment we believe, or the crisis text line folks believe that there is an imminent threat, they do respond.
Sure. That's nice to know as a parent as well, right?
Yeah.
So then you get the information back and you start seeing that it's that it's being used.
Mhm.
Do you do anything else with that information?
It's really more about because all we get is a number. We don't get
Okay.
the age of the student. We don't
Right.
get any of that information. And I think blessing and a curse. It's good
Sure.
because that helps students use it.
Right, right.
For us, it's very general information, and I
Yeah.
think more than anything, it just tells us even if it's only 20 kids, right, in a few months, that's 20 kids that needed that help and maybe wouldn't have had it otherwise.
That's absolutely right. That's absolutely right. And that's 20 other kids who may have told somebody else that they could use it as well in the future. I mean,
Absolutely.
quite frankly, if it's only 20 kids, that might be a blessing in and of itself. It means it may hopefully they're feeling a little bit
Yeah,
better.
absolutely.
Uh, what other services? Okay, so we've got that in the text. Go ahead. Sorry.
Oh, of course. So the other one is Care Solace, which is kind of like they brand themselves as a concierge service. So this was a contract that we were able to get into. Care Solace, as I said, when parents were trying to call or families were trying to call to get appointments for their students to get mental health support, they're on these waiting lists. And if you've dealt with insurance or you've ever had to call the doctor's office and you're sitting on hold, it almost becomes it's overwhelming and then you give up. And so that's
Right.
what was happening with a lot of families. Care Solace takes that away. So basically, when a referral goes into Care Solace, their people are the ones who make the calls for you. So they'll make 30, 60, 90 calls to get an appointment for you based on whatever the needs are. And they guarantee that within 2 weeks. So that's
Wow.
a changer. So so that was huge because families, so on our district website, there's a link and it's not just for our students, it's for our students and their families. It's also for our staff and their families. And
Oh,
so they can go on and they can either do a referral themselves and then Care Solace will just start trying to find them the appropriate provider, or there's an anonymous search and they can look for providers who offer the service that they need. But in addition to that, our counselors, our social work, any of our school staff who are trained can do a referral for a family. So if we have a student who is experiencing anxiety, depression, any of the things, we can sit down with the family and say, this is a resource. Would you like us to put this referral in for you? And then as a school, we continue to follow up to make sure that that referral was processed. And then the other piece that Care Solace does is they follow up with the family after the first appointment to make sure it went well. Did you feel good about this provider? Did you want somebody else? Um,
That's incredible.
so that's been a huge, huge resource for us, and something that our district has committed to maintain simply because we know it's a huge need.
Well, and parenting a child that has any type of mental health struggle, whether it's chronic or just temporary, can
Yeah.
be so overwhelming.
Yeah.
It's terrifying. And the system is so convoluted. You don't know where to go. Like you said, it's plugged up. I mean, wait lists are incredible. That is a great resource.
Yeah, and I think in addition, it doesn't matter what insurance you have. It doesn't matter if you don't have insurance. They have the resources regardless, so they'll get that information. And to your point, when we started this entire initiative and really talked through it, the adults in the rooms, exactly what you just said, we echoed that sentiment of you can have all the resources in the world and you can be the most educated person, and when it's your child that is at risk or your child who's hurting, you just can't, you need an adult yourself, somebody
Yeah.
to walk you through the next steps. And so knowing that, and then knowing that some of our families don't have those resources
Hmm.
or don't know where the next step is, what about for them and their kiddos? So this was something that really met the needs of everyone across the spectrum.
That's amazing. That's a wonderful resource. Okay. So we've got that.
Yeah. And then
Already I'm sold. I'm like,
it's been incredible. I mean, it really has. And I think even for staff, it's been incredible because we talk a
sure.
lot about students, and the people that are in the room with our kids, they struggled too. And
Yeah.
so them having access to those supports was really important as well. And the nice thing with Care Solace is they offer in-person appointments, but they also offer virtual appointments. So for families that are working parents and
Hmm.
I can't get my student to that appointment, there's a virtual option. So they make it really, really they make it really easy to access the help,
Yeah.
which is great. The final piece of the Let's Face It Together program was wellness teams and that site level support. So this was something that, for those not familiar, PERT, the Psychological Emergency Response Team, is a county resource. They partner with the Sheriff's Department. So when a student is at imminent risk of hurting themselves or somebody else, PERT comes out and does an evaluation, and it's typically done with a mental health clinician and a sheriff's deputy. Because if the student needs to be placed on a hold, they are typically taken in by a sheriff's deputy to the hospital to get the help that they need. PERT was completely inundated with calls for service during this time. And so we really thought about, ideally, what would we want for our kiddos that are at home, that are experiencing mental health emergencies, and how can we better assist them? And so the wellness team is kind of where we landed. And so our wellness team was comprised or is comprised of two different positions. One is a school-based mental health clinician, and so that's either a social worker, counselor, or school psychologist. And then the other person is a family and community engagement liaison. And so as a pair, they're a team. And when we know we have a student that's struggling, they actually go out to the home. And
Well,
the clinician is there to really talk through with the kiddo. Is this an emergency? Is this more just, school avoidance? Is this anxiety? Were they being bullied? What are the pieces that are keeping us from coming back to access our education at school? The family and community engagement liaison is there to really help the parent. And
yeah,
so, just like as I just referenced, when you have a child who's struggling, the parent's struggling, the guardian's struggling. And so
absolutely.
they are there to help. Is this housing insecurity? Is there domestic violence? Um, what are the other pieces of this that the parent needs assistance with so that they can better support their child? And all of this is done so that we can connect that student and family back to the school site where they have on campus support.
Hmm.
So going out to the home was really important because for some of our families, they didn't even know where to access the help and the care. So going out and being able to give that information, and then for those kiddos that were really struggling, saying, I'm going to go with you. I'm going to be there on your first day back at school. We're going to walk to class together. You need me to stay? I'll stay. And
Yeah.
providing that for them, and then introducing them to their support people on campus so that every day they show up, they have those trusted adults, and then following up with those families and those kiddos. So we initially, when we thought about this, thought it would be kind of a handful of kids that were going to need this type of support. And what we saw was it was a lot larger than that. Um,
Really?
and so, yeah, so we had 6 teams initially, who were regionalized throughout the district. And they worked with specific school sites so that they got to know their communities and their support providers on campus best. And then they stayed with those families throughout the entire year to
Hmm.
really help make sure that they were reconnected back. Because for some of these kiddos, it wasn't the first year that they weren't going to school. This was something that had been going on for years where they just struggled to get there, and they needed a lot more than just a one-time visit. Um,
Right.
some families don't have housing. And so they need additional resources. And so there was a lot more to it. Um, when the funding ended, unfortunately, we weren't able to maintain 6 teams. So we still have 3. And they really focus on looking at those students who are chronically absent and
Yeah.
going out, because attendance is a symptom. It's a
Yeah.
symptom of something else larger. So going out and really working with the families again to get them back to the school site so that then the school resources can kind of take over and implement all of the different offerings we have at school. So whether that be they need a modified schedule, whether that be they need counseling services on campus, maybe they need to have lunch somewhere in a quiet space because the school is just too big and that's overwhelming. So just all of the different things that maybe we don't think about day to day. Once the kids trust us, they're really good about telling us what they need.
Now, and this is available to kids as young as kindergarten?
As young as transitional kindergarten, 4 years old. Yeah,
Oh, right. We didn't have transitional
yeah.
kindergarten when I was there, but wow. And then all the way through high school.
Yep, high school and beyond. Yep, we still have students that in our adult transition program who are with us until I think about 24, and those are students with exceptional needs. And so when their
Wow.
families need additional support, we assist there too.
Wow. Wow. And I think, we know that school is such a huge component for a child. I mean, it's like going to work, right?
Yeah,
And for a family that's having a child that's struggling to get to school, that's has, you know, just so many impacts on their life over and above just even getting to school, right?
yep,
I mean, the parents have to then sacrifice. If they're two working parents, somebody's got to help with that. The child's not getting socialized, they're not getting educated, and then I know that the more that you encourage, or not encourage, I shouldn't say encourage, the more that you give into some of those anxious thoughts, the worse and worse it gets.
yeah.
And then it becomes a real big issue.
Absolutely. Absolutely. And so getting them back on campus and finding those things that are going to help them feel connected, it's a
Mm-hmm.
huge initiative. I mean, not even initiative, it's our goal in San Marcos, and it has been for the last few years, is connection and belonging. So
Yeah.
academics is 100%, we all know like that's what kids come to school for, but they also come to school to
Yeah.
belong. And
Yes.
so that's going to look different for every child. So for some, being an ASB, that's going to be their thing. For others, it's going to be band. For
Yeah.
others, it's going to be, our CTE pathways. But some of our kiddos they're so overwhelmed with their own, anxieties or their own negative thoughts, they don't even know where to start. And so having somebody that can really take the time to walk through that with them to, what are you good at? What do you
Yeah.
like? Let's find something for you so that you want to come to school, and
Right.
let's prioritize that for you so that, again, maybe you don't come 5 days a week, but you were coming 0. So if we can get you here 3 a week, that's
Yeah.
a win.
That
And
is a win. Yeah.
celebrating those small wins, and just knowing everybody's on their own journey and letting them know, but we're walking with them. We're doing it together. And I think that's really at the heart of the entire program, not just for our kids, but for our families, that they are not alone.
Hmm.
We've got their back. We're doing it together, and their individual needs matter.
This whole individual thing is a foreign concept for some of us that are older, right? Like we went to high school, there was like 5 clubs, right? And you
Yep.
had a lot of kids that um were probably missed, right? They weren't present. Even if they were there, they weren't present, they weren't connected. Now these kids have an opportunity, especially moving to high school, where the high schools are so big
Yeah.
and can feel very intimidating. There is a home for most of them,
Yeah.
but it's navigating that and finding it. for those kids. That's great. So, what successes have you had? I mean, I can only imagine that there's just a thousand successes, but what are some really things that you're proud of that have stood out?
Yeah. One of the things that happened early on in the during the program is, we have school resource officers that are sheriff's deputies, but they work specifically with our schools. And
Hmm.
so for a lot of our kiddos, they see those people as the enforcers, if you will, right? They're only there
Hmm.
when I get in trouble. And that's really not what they're there for. I mean, they are there to be a resource to our kiddos and the community. And so when we started the program, we got buttons for them that said "Let's Face It Together" that had the same logo that was all over the school sites. One of them was one of the SROs was working overtime on a weekend, and he had his pin on, and he was just in one of the local convenience stores, and a kid walked up to him and pointed at the pin and said, "Why are you wearing that?" And he said, "Oh, I work for the district." And he kind of explained it. He goes, "They have that at my school. I've seen that." And so it
Oh.
started this beautiful conversation between the two of them. And this is a kid who typically would not speak to law enforcement, who typically would have been fearful of law enforcement. And in the community that he lives in, law enforcement is seen as not a great thing. And so
Hmm.
we saw that as kind of it automatically opened a door into
Yeah.
a conversation that wouldn't have happened before. But because this student knew what it was from being at school and then saw it and recognized it, instant connection. So that was a
Yeah.
small one from the very beginning, but we love it because it shows that messaging mattered. And
It
it
did.
was
Yeah.
worth doing that at the school sites. And it was worth making sure that all of our partners had the same type logos on them so that students knew. Because sometimes these law enforcement officers are the ones that are going out in the middle of the night when
Hmm.
bad things happen. And
Hmm.
when the kids can recognize on them, like, oh, I know that sign, that's familiar to me, and I know I can trust you. Sometimes
Yeah.
it takes that level of anxiety down. So that was a huge win. One of our biggest wins is we have a student, she graduated last year, and she was in, and she's spoken about this very openly, so I'm allowed to share it.
Okay.
But she was in the foster system for most of her life. And she went to Mission Hills High School. And when she got there, she tells the story of she was just so angry and she hated everybody and she didn't want to be there. And she made sure everybody knew it. And so she was constantly trying to get in trouble and constantly trying to get booted out so she could go back to her foster home. And the people there just kept trying. And they just kept trying to find ways to connect with her and let her know they weren't going anywhere. And so she got up and she gave several talks last year to talk about, for the first time in my life, I had a home and it was at my school. And
Oh my gosh.
and she credits her success and graduation, and she's living on her own now and all of those things. And she says, I couldn't have done it without the trusted adults I had. And I couldn't have done it without the help of people who believe in Let's Face It Together. And so those are the types of stories like that's a huge win for us when a kiddo can say, my whole life I was looking for a home and I found
Yeah.
one. So
Christy, I think I want your job.
I don't think you do. This is the part.
What a difference though that you and your team, I know it's not just you, it's you and your team
Absolutely.
and the city have been able to give this community. What I
Yeah.
mean, that's so I know that we're talking about it from the city of San Marcos and San Marcos Unified School Districts. Do you know of other programs like this that are outside of this that outside of your little community that are happening elsewhere? Or have other districts come to you and asked about the program to expand it?
Yeah, we were able to present at quite a few places last year on the program. So down here in the county, and then we actually got to present up in Sacramento as well. And so a lot of people have reached out just to kind of find out like how we structured it and the ways
Yeah.
that we've monitored it and what data tools do we use. And so I think our big piece when we talk to other districts is look at what you currently have and leverage the partnerships you have. So we haven't seen anybody necessarily take this and run with it, but I think other folks are really looking at, can they take pieces of it
Right,
and
right.
can they implement it within their districts? We're always open to those conversations. We love talking to folks about what they can do to better support their communities because education is it's all encompassing and it has changed a lot post pandemic. But when we think of whole child education, I think oftentimes we forget about those partnerships outside of our districts. And for us, the city of San Marcos was a critical partner for us. So had
Mm-hmm.
that not happened, we may not been able to have the success that we currently have right now. And then partnerships like Care Solace and the crisis text line, but really looking at what you currently have in place and what's out there and what works for you. So
Right.
we had been having these conversations. And like I said, when lightning strikes, it strikes. Because sometimes somebody will remember 3 months down the line, I remember somebody saying they really needed support with mental health. We now have this funding. Let's go back and
Mm-hmm.
help them. And that's our encouragement to everybody is don't stop asking, don't stop talking about it. Just keep telling folks that this is a priority for you and the right partners are going to come.
Well, and you mentioned it several times throughout this conversation is that they've got existing resources.
Mm-hmm.
And I think messaging is such a huge piece in that, and that parents, a lot of parents don't know
Yeah,
what's hidden behind those school walls that
absolutely.
can help them. And so even if it's not a big, fantastic program like Let's Face It Now, there are still resources out there that are free and are available to any child that's going through a school, going through at least public schools.
Yeah, absolutely. And I think, like I said, counselors, social workers, school psychologists, but even a lot of our nurses. Our nurses, I oversee our health services team as well. And many of them have now attended trainings at the county level for mental health first aid so that they know
Mm,
better how to help when students are coming in. And maybe what looks like a stomach ache isn't
right.
just a stomach ache. Maybe that's really anxiety. And so we've been able to really do a lot of training within our teams to help. So when a student comes into the health office with a stomach ache that really looks more like anxiety, calling the counselor or the social worker in for that partnership and vice versa. And then
Yeah.
in addition to that, we have campus supervisors and noon duty supervisors who are out there on the playgrounds and in the hallways. They see things a lot of the times that maybe the other folks don't. And so
Mm,
we've really prioritized making sure they have training. And so we've had trainings for them on how the brain works and, why students behave certain ways. And this year we had a mental health 101 training for them that if they encounter a student who seems to be in the midst of a mental health emergency, what should they do? Because I
mm,
think ultimately, I was an English teacher, I wasn't a social worker. Um, but sometimes we're called to do things beyond what our credentials told us we were coming in for, right? Like, so
right.
sometimes I'm a mom in a classroom, because they just need that momming at that point. Sometimes you're the therapist, the unofficial therapist that's just listening to what happened over the weekend. And sometimes you're the English teacher. But I think everybody wants to do it right. Some folks
Right.
want to make sure they don't say the wrong thing. So making sure we provided those resources of you don't have to have all the answers. Every adult on our campus, you don't have to have all the answers. You just need to be a kind, welcoming space and know where to get the answer. So know that when that child is struggling, you know what? I am so sorry you're going through that. Why don't you come with me? I know exactly who we can go to. I'll take you there. And then
Yeah.
walking with that child. So just arming all of our staff, regardless of, and I think that can be said for any district in any place, making sure that staff themselves know the resources and that parents, to your point, know the resources so
Right.
that I may not know what to do, but I know where to go.
Right.
And so,
And I want you to feel comfortable enough as a child. I want that relationship that you trust me enough
yeah,
to allow me to take you to where we can get you some help.
yes, absolutely.
Well, I know that it's only 3 years in the making. I'm excited to see what other impacts it makes as it continues to flourish. I just a beautiful gift for the parents and kids of San Marcos.
Yeah.
Christy, thank you so much for joining me today.
Thank you so much for having me.